Hi folks, this is Larry Belt from Go Medicare Insurance Plans. We're watching this video today so that you can learn how to analyze your own drugs to find the most cost-effective drug plan on the Medicare.gov website. This site we have been using for the last few years because it works very well at this point. It's not the same site that you've been hearing about, all the stories about healthcare reform and Obamacare. This is a different site. It's been tweaked over the last 5 or 6 years, so it works pretty well, and you've got to well learn how to do this so you can help your friends and family. As I said, we've been doing this since 2006 for folks, and unfortunately, because of certain marketing restrictions, you're going to need to do this yourself from this point or call Medicare.gov to get help. But we certainly want to help you in showing you how we have done this in the past. And the important thing to remember is there's no right plan for everyone. It's based on the medications you're on, and you want to look at your bottom line, not just your monthly premium. Don't freak out if your premium went up. Maybe your costs went down. So as you get these packets in the fall about how the plan is going to work for the next year, you're going to want to look through that and see if possibly you want to make a change. You can start looking October 1. They'll have new information up, but the site generally works very slowly the first few days. You may want to wait a week or do it late in the evening. You can enroll in a drug plan as of October 15th through December 7th. We can help you with an enrollment, giving you paper applications and so forth, sending those out on the plans that we handle. We don't handle them all because some don't work with agents. Some are rarely cost-effective options for our clients. So we just handle about 4. Now, if you're not comfortable, as I said, going to Medicare.gov and doing this yourself, get somebody to help you that's good on the internet. And if not, that's not an option. Call Medicare up 1-800-MEDICARE, or we've translated that number to 800-633-4227. And from this point, if you have questions as you get on this website, please don't call us about that. We just don't have time to walk you through it. That's the purpose of this tutorial. If you do have questions, email them. So it's a pretty busy time of year, and the site is very intuitive. If you spend some time, it should open up right for you the way you want and give you the information you need. And it works well. It may bog down early on, but for the most part, we've had very little problems with it. We had been doing hundreds of these. What carriers do I handle? As I said, about 4. So Humana, SilverScript, AARP, and Blue Cross. The first 3 come in as very cost effective. One of the 3 generally over 90% of the time. So there's a good chance we can help you enroll in your next choice. So let's, at this point, move on to Medicare.gov. You don't have to do this with me as you're watching the video. I'd watch the video, then go back and do it yourself. So right now we're on Medicare.gov. And the first thing we do is go to the center here under drug coverage. These boxes will pop open, toggle down to find health and drug plans. From this point, they're going to want to know where you live, so put in your zip code. And it really doesn't matter as long as you're in the right state, frankly. And if you want this process to move along for drug plans, just answer both of the next boxes. I don't know what kind of coverage you have, even though you do. So you get right to the point here, okay? So answer, I don't know for these 2 questions. So we'll go to the next window here. And at this point, they're going to ask you to enter your drugs. And you'll just scroll down here and you can start entering your drugs, which is what I'll do. But first, I want to go over here and look at this box. I want you to note this. You can go back once you've entered your medications and make changes, look at your list again, tweak it, reanalyze it, whatever. But later on, this will be populated. You'll have a drug list ID, and a password date. Record those as soon as it gives it to you so you can go back without having to re-enter everything. So let's enter a few medications right now. I'm going to start out with some cheaper generics, and this is levothyroxine sodium. We're going to enter that. Now what will happen from this point is a box will pop up with a bunch of different choices. Usually your choice will be on the top. They also, so you don't make a mistake, want you to look at some other choices, make sure you've got the right one. So I'm going to enter that here. And if you had just entered a drug that had a generic equivalent, a box would pop up at this point and ask you, do you want the generic or do you want the brand name, which is more expensive? And you'll be able to make that choice. Here you can see they're giving us choices of dosage, quantities per month, and how often you order. Leave this at once a month, and leave this at I get my medicine from a retail pharmacy, because you'll be able to see mail order as well as we get to the end. So we're going to, as we go through, leave these just on the default so you'll know, just to make things go quicker. But just so you know, you have a choice to change those, obviously, to whatever you're using. So we'll add drugs and dosage. And we'll scroll down again and we'll see where they've added that for us. So that's a good thing. That's what we wanted. We're going to try another medication that's a cheaper generic, omeprazole, which half the world is on. It's for acid reflux. And I know I didn't do a very good job of pronouncing it, but we're going to add it. And then again, the next box comes up and gives you the choices and make sure you've got the one you actually want. OTC, by the way, means over the counter. If it's over the counter, they're not going to cover it because it's not a prescription drug. This is a prescription drug plan. So again, we have the choices of dosage and everything else here. So we're going to add it, just use the default to move things along here. And now they're both populated here in our list. We're going to add a few more. Pravastatin sodium. That, I believe, is something to do with blood pressure medications. So I'm going to add this drug, and again, we'll go with the default dosages, but you're welcome to change those, obviously. And then one more, as we'll go back up here, add another cheaper generic. Oops. Okay, so then again, once more, we'll add the, make sure we've got the appropriate dosages and quantities and so forth in there and add that. And you can see, fortunately today the site's moving along very quickly, but we've got our 4 generic drugs in there. Now, let's get to a couple that are more expensive because I want to show what happens when one goes, unfortunately, into the donut hole. So we're going to add Novolog. If I could spell it right, we are. Novolog, and we're going to choose the Flex Pen, which is a type of way of putting the medications into one's bloodstream. It's easier and more expensive, unfortunately, than using a syringe. So we're going to pick the Novolog we're using. The brand, it's a brand name drug. Unfortunately, there's no generics for this. So we're going to confirm these are the way we're getting the medication, that it matches up well with what we've been prescribed. Then we'll enter one more, which is Levemir, which is another drug for diabetics, and probably most people don't take the two together, so don't get any ideas. So we'll add Levemir Flex Pen. Popping up again is our choices of dosage and how we want it packaged, and quantities, and so forth. So we're going to add that. It's going to be our last one. And you can see at this point that this list, this box here has been populated with the drug ID list and the password date. These are the two things you'll need to log back in. And we'll scroll down. My drug list is complete. And then we're going to get the news. Well, what happens next is we're going to pick a pharmacy. And I always like to pick the client's actual pharmacy and a Walmart, because sometimes the Walmart, and I don't work for them, but sometimes they will have an option that might be significantly cheaper if you use theirs. So You don't always have to go to the Walmart pharmacy, though. You can even order mail order. So let's pick a CVS, and then I'm going to go. You can see that's been added up here at the top. I'm going to scroll down and go to the 4th page and look for a Walmart. And I'll add a Walmart here. So it'll give us the ability to look at what these costs will be at these 2 pharmacies. At this point, we're going to continue to plan results. And at this point, we're going to get the info we're really looking for, which is cost info. What you want to do, the next box here, is answer that we're looking for a prescription drug plan. We're not looking for a Medicare Advantage plan. So rule those 2 out and just go with this. And we'll continue on to plan results. And as you can see, it's very intuitive. It's just a step-by-step process. And now we'll get the results. First, it'll show you how original Medicare would cover your drugs. Well, they don't cover them very well because your Part A and Part B don't cover drugs. So don't waste your time looking in there. Scroll down to the first option, which is ranked in order of cost effectiveness. So it says this is how it's sorting them. Lowest remainder of the year retail cost, which is if you're hunting for cost effectiveness, this is what you want. You don't want to pick a plan by premium because the copays may be high. You're looking at your bottom line. So that's what this does. It looks at the bottom line. But some people will pick a plan name, or maybe their neighbor told them about a great plan they like. But leave it at that as you're looking at this. So we'll see our choices in order. We go from SilverScript, First Health, AARP, Humana, etc. And you'll see WellCare down there as well. Some of these names I'm sure you've heard of. But so let's pop open SilverScript in a minute here. But what it's going to tell you is this box is a little confusing. I would get into the actual plan instead of looking at this. But this is going to tell you what your premium is. This will tell you if your plan has a deductible and this one doesn't. Over here, you want to know if your drugs are on the formulary. That's obviously important, and usually they all are, because that's why the plan will come up as most cost effective, because your drugs are on that formulary. Now you'll note it says drug restrictions, and you can open that up if you like and look at what they're doing with your medications. And this one just has quantity limits. It doesn't need prior authorization, and it doesn't need step therapy. So quantity limits usually aren't an issue. If you're taking a quantity that just seems out of whack in terms of how the medication is used by doctors, then you might have a problem with this. But usually people have problems with the prior authorization and step therapy. But all of these plans generally have certain restrictions in these 3 areas. So there isn't a great plan that doesn't. That's how they keep their costs down in some effect. So we're going to go back to looking in depth at how the costs are with this SilverScript plan. And you can go down and do it for the rest of them as well if you really want to get into it and analyze it. SilverScript is one of the plans we handle, so you can request a packet from us on that. But if it's a company we don't, you can call the member number and do an enrollment over the phone. It's a little laborious because you got to listen to a lot of recordings, but I like to do them with paper if you can. So again, they're reviewing the premium, and there's no health insurance in this, so that's an NA. And then the deductible. So $33.80 with a 0 deductible. So let's go down and look at the actual costs at CVS. This first column is related to what the insurance companies pay for that medication. It's not your cost, it's their cost. And hopefully your cost is lower than their cost because the plan is subsidized by the government. So this poor fella has monthly costs of $749.17. But what he wants to initially look at is the initial coverage level. What's he going to pay for his medications when he goes to the pharmacy? Well, his copays are $48 a month for those $740 worth of medications. That's a good thing. We can also look at how Walmart might treat his medications, and it's identical. You can see any change there. Mail order is generally a little less than triple the cost. So you can see you're saving a little money. If you divide this by 3, you're saving about $8 a month if you mail order, $120. If you want to mail order, when you get your plan enrollment packet, it'll show you how to do so in there. But let's go back to CVS and continue trying to understand this. What happens, what puts you in the coverage gap, also called the donut hole? This is column over here. It's your costs. And basically, you're getting an allowance of about $2,800 a year. So this fellow will go into that donut hole in about 3.5 months or so, well, almost 4 months. And so what happens is for the first 3.5 months, he pays about $48 a month for his medications. Once he goes into the donut hole, though, he pays $366.94 for those medications. So about half of, a little less than half of the cost of the drug. Now, 2 years ago, he would have paid the full cost. So the plans have improved in that respect. You can come out of the donut hole, but you have to spend close to $5,000 in what they call true out-of-pocket expenses, copays, deductibles, things like that. And you can study this whole concept on the website and different websites about the donut hole to better understand it. But you can come out of the donut hole. Most people don't. Their costs are not that high that they'll come out. But if they do, for the remaining months, this guy, for example, would pay $45.10. Now, as you're looking at this for next year, you're going to see a bar graph. And this is important for somebody that is going to the donut hole. They can better look at their medications cost for the full year, January through September. In September, late September here, we only have the ability to look at October, November, and December. After October 1st, you're looking at 2015 plans on the website, and you'll be able to see your costs for the whole month. And this includes premium, too, this amount you'll see up here. Now, one last thing I want to say before concluding is that when you open up this website and you start to enter your information, it'll give you an option. Do you want to look at 2014 or 2015? For most of us, we'll be looking at next year, 2015. And that's what the site should default to. But pay attention to that and make sure you're analyzing your drugs for next year. So good luck with this process. I hope this has been helpful. Just spend some time with it. I think if your computer's working well, it should work well for you. And if you need help from a friend, call or email us. If you need applications from SilverScript, from Humana or AARP, email or call in for those, and we can help you with that. But good luck with this process, and I hope everybody has a good fall.